For many years, most people have heard the same advice from their health providers. An ideal blood pressure should be 120/80, and the lower you can get your numbers, the better. This has been the message repeated in clinics and articles for decades. But recent findings published just weeks ago in a respected American medical journal reveal a different story, one that's especially important for those over 65. And it's information I believe every older adult and their loved ones need to know. See, striving for a blood pressure of 120/80 as we age may not be as harmless as previously thought. For those in their later years, working to achieve these numbers might actually lead to falls, fainting, and other serious consequences. We're going to unpack why the traditional advice may not apply so neatly to older adults, and why, for seniors, lower isn't always safer. Before we talk about the numbers you should be aiming for, I want you to really understand the why. Because only by understanding what happens in an aging body can you make the best decisions for your health or for someone you love. But first, if you're willing, share your current blood pressure numbers and your age in the comments below. This information helps others see what's normal, what's common, and how we're all different. I'd like to share a story that changed my own understanding of blood pressure in older age. The experience of Eleanor, a woman who showed me firsthand how striving for ideal numbers can sometimes go wrong. Eleanor was 78 when she and I met. She'd been told she had high blood pressure when she turned 68, and like many, she started medication under her doctor's care. Her blood pressure at diagnosis was 152/88. After 2 months on medication, that number came down to 138/82, and her doctor felt they were making progress. But the goal was always 120/80, so her doctor increased the dosage. 2 months later, Eleanor's numbers edged closer, 128/76. The doctor then decided it was time to add another medication, reassuring her that once that ideal number was reached, her risk of heart issues would be at its lowest. Eleanor was diligent. She trusted her doctor completely, never missing a pill and monitoring her pressure at home. Eventually, Eleanor's blood pressure was averaged at 122/78. Her doctor was thrilled. "Perfect," he said. "Stay on this regimen." Initially, Eleanor felt fine. She brushed off a bit of extra tiredness. After all, she was 78, and tiredness comes with age, doesn't it? Then, something changed. Whenever she stood up from a chair or got out of bed, the room spun for a few seconds. That dizzy feeling didn't go away quickly. She started moving more slowly, trying to adapt. Her daughter noticed, gently asking if something was wrong. Eleanor explained, and together they decided to call the doctor. The nurse listened and relayed a message. As long as your blood pressure is in range, a bit of dizziness is probably just a part of getting older. "Make sure you're getting enough water," the nurse said. But the dizziness got worse. 3 months after finally reaching the target, Eleanor woke one morning, sat up, and stood to walk to the bathroom. The room spun more violently than ever before. She tried to steady herself, but her knees gave way. She crashed hard and broke her hip. Her husband called for help. Lying on the floor, unable to move, Eleanor was soon in an ambulance on her way to the hospital. There, her blood pressure was measured at 118/74 lying down, which dropped dramatically when she stood up. She had what's called orthostatic hypotension, meaning her blood pressure fell too much when changing positions, leaving her brain deprived of the blood supply it needed. The injury meant a grueling surgery and even more challenging recovery. Eleanor spent weeks moving through a slow rehabilitation process, no longer able to live independently. Before the fall, her days were full, out in the community, at the shops, visiting friends. After, she barely left her home, afraid of falling again. As her mobility declined, so did her health, and this loss of independence changed her life permanently. In the months that followed Eleanor's fall, her world became smaller. Activities she once enjoyed felt out of reach. Fear kept her glued to her chair, and her daughter moved in to help. Eleanor's body grew weaker as she spent more time sitting and less time moving. 6 months later, an illness set in. Fluid collected in her lungs, making it hard to breathe. Hospital care, medicine, none of it was enough this time. Eleanor's family was left grief-stricken, wondering how things had gone so far wrong. The hardest part to accept was that it all began after reaching what was supposed to be a perfect blood pressure. How could the very number everyone says is healthiest lead to this series of complications? The answer, it turns out, is that while 120/80 is a good goal for many, it's not the right goal for everyone, especially not for older adults. So, why is this the case? The bodies of older adults work differently from those who are younger. And while a lower blood pressure does reduce the risk of certain heart problems for someone in their 40s or 50s, it can bring new risks for someone over 65 or 70. Let's look at why this is. As we grow older, the blood vessels in our bodies become stiffer. Imagine garden hoses that have less flexibility. This stiffness is common with age and means our blood vessels can't react as quickly to changes in circulation. When standing up from a sitting or lying position, it takes more effort for blood to reach the brain. If pressure is too low, the brain might not get enough blood, leading to feelings of dizziness or lightheadedness. This is a major reason why older adults are more prone to falls when their blood pressure is kept too low. Not only do vessels become stiffer, but the body's sensors, called baroreceptors, that help control blood pressure also become less responsive with age. In younger people, these sensors will quickly tell the heart and blood vessels to make changes when you move from lying down to standing up. They act quickly so the change in blood pressure doesn't lead to a drop in blood flow to the brain. But in older adults, this system loses speed and efficiency. Another important change with age, the way the body handles medication. Kidneys and liver work more slowly, meaning medications can build up more and have stronger effects than doctors might expect. This means an older adult can be much more sensitive to even small blood pressure medication doses than someone decades younger. A dose that lowers blood pressure by just a little in a 50-year-old could push an 80-year-old into dangerously low territory. The risks that older adults face are different too. While it's true that very high blood pressure increases risk of stroke and heart problems over many years, the danger of a fall or faint from pressures that are too low is much more immediate for someone in their 70s, 80s, or beyond. A serious fall can change or even shorten a life quickly. Sometimes it's safer to have blood pressure a bit higher than textbook perfect to help avoid these tragedies. Let's look at some cases that illustrate just how individual blood pressure needs to be with age. Harold, for instance, was a healthy 72-year-old whose pressure was originally 146/88. His doctor tried to lower it to 120/80 and prescribed medication. But when Harold's numbers dropped, he felt exhausted and dizzy. His quality of life suffered. After cutting back on his medication and letting his pressure rise up to 136/82, Harold's energy and focus came back. For him, a slightly higher pressure was safer and more comfortable, even though it didn't meet the traditional standard. Meanwhile, Margaret, the same age as Harold, had different health challenges, diabetes, and a history of heart problems. For her, blood pressure of 146/88 was riskier. With her doctor's careful oversight, medication brought her pressure down to 130/80, and Margaret didn't experience dizziness or fatigue. Each person's safe range looked a little different, depending on their overall health. Individual differences matter greatly when it comes to managing blood pressure in older age. Ruth's story is another example. At 83, Ruth lived with diabetes, heart failure, and reduced kidney function. Her blood pressure was 168/92, and her doctor considered dramatic medication changes. But in Ruth's case, bringing her numbers down aggressively could have increased her risk of dizziness and dangerous falls. Instead, her care plan focused on maintaining her independence and comfort, leaving her blood pressure closer to 160/90. For Ruth, this decision helped her avoid unnecessary side effects, and she stayed active and stable for years. On the other hand, someone like William, a healthy, active 70-year-old with a blood pressure of 142/84, didn't have any major symptoms. His doctor suggested lowering it further, but William felt well and enjoyed his usual activities. Together, they decided his current numbers were acceptable for his age and health status. William continued living an active life, checked his numbers regularly, and didn't face any complications. It's also crucial to understand the difference between systolic and diastolic blood pressure. Systolic is the top number, representing the pressure when the heart is squeezing blood out, while diastolic is the bottom number, showing pressure when the heart relaxes. As people get older, systolic pressure often goes up due to vessel stiffness, but diastolic pressure can stay the same or even decline, creating a wider gap between the two numbers. This is called widened pulse pressure and is common as we age. For older adults, low diastolic pressure, especially below 60, can restrict blood flow to the heart and brain. This is something doctors need to monitor. A pressure like 150/75, for example, might be acceptable for a senior, as long as the lower number, diastolic, doesn't fall too low. When we talk about blood flow, especially to the brain, it's important to realize that gravity works against us as we age. Pumping blood to the brain takes more effort, and if systolic pressure goes below about 110, symptoms like dizziness, fatigue, or confusion can appear. Sometimes these symptoms are mistaken for normal aging, when they might actually be signs that the brain isn't getting enough blood. There is increasing discussion, backed by research, about whether blood pressure that's too low in older people can raise the risk for memory difficulties. Some studies suggest that if blood pressure is lowered too aggressively, it may reduce blood flow to the brain and contribute to problems with thinking and memory over time. That's why experts now caution against being too strict about ideal numbers for every older adult, especially for those experiencing symptoms. The kidneys are another organ that need a steady blood pressure to function well. When pressure drops too much, kidney function can decrease, sometimes leading to other complications. This is particularly true for people whose kidneys are already weakened by age or disease. So there's a balancing act, protecting the kidneys by avoiding very high pressure, but preventing harm from pressure that's too low. So what do these lessons mean for choosing a blood pressure target if you're over 65, or if you're helping someone else make these decisions? Recent research highlights that for most older adults, especially those over 75, the safest and healthiest range is often higher than traditional guidelines have suggested. In a large new study of people over 75, the lowest risks of complications and the best outcomes were found not in those with pressures below 120, but in those whose systolic blood pressure, the top number, was between 130 and 140. Those whose pressures were lower than 120 faced higher chances of dizziness, falls, and even hospitalization, while those over 150 faced increased risks from strokes and heart events. The sweet spot for longevity and daily function was in the middle range. It's important to remember that there's no single number that's right for everyone, especially as people age. Along with overall health, previous medical conditions, and personal risk of falls, every older adult requires an individual plan. Here's a general guide, but always discuss it personally with your health provider. Healthy, active adults aged 65-75, a systolic top pressure of 130 to 140, and a diastolic bottom pressure between 70 and 85 is often a good target. For those aged 75-85 who remain active and fairly healthy, a systolic pressure of 135-145 and diastolic 70-85 may be safest. For older or frail individuals or those over age 85, often a systolic pressure of 140-150 with diastolic in the 70-85 range helps protect independence and prevent falls and fainting. If you have conditions like diabetes, a past stroke, or heart disease, your safe numbers may be a little different. In these cases, a slightly lower pressure might be needed, often a systolic in the 130-135 range, but rarely as low as 120, and always with close monitoring for symptoms. For those with kidney disease, the calculation can be even more individual, because both very high and very low pressures carry risks. Again, this must be determined with your healthcare team. What matters just as much as your target number is how you feel as you get there. If you ever stand up and feel dizzy, lightheaded, or disoriented, this is a warning sign your blood pressure may be too low for your age. Always report this to your doctor. You can check for this at home. Here's how. Rest lying down for at least 5 minutes, then measure your blood pressure. Stand up and immediately check your pressure again. If your systolic drops by more than 20 points, or your diastolic by more than 10, this is called orthostatic hypotension. and your care plan may need adjusting. Eleanor's story and others like hers show the dangers of not catching these downward swings. Her lying down blood pressure was within target, but the big drops while standing went unnoticed until they caused real harm. To make sure you are truly aiming for your safest and healthiest blood pressure, here's a step-by-step plan you can follow at any age, especially as you grow older. Track your numbers at home. Check your blood pressure morning and evening for at least 2 weeks. Keep a written log. Office readings can be misleading. Check for big drops when you stand up. As described earlier, always note whether your pressure falls dramatically when you move from lying down to standing. This can reveal hidden problems. Pay attention to your body. If you notice symptoms like dizziness, unusual fatigue, difficulty concentrating, or confusion, share this with your doctor. These could be signs that your blood pressure is too low. Take your other health conditions into account. Any history of diabetes, stroke, heart, or kidney disease means your ideal target may be different. Your health plan should be personalized. Discuss everything openly with your doctor. Bring your home measurements, your symptom notes, and your standing tosh lying tests. Ask questions. Make sure your care is not based on a one-size-fits-all approach. Make changes slowly. If medications are being adjusted, do it one change at a time and check your responses carefully. Monitor for any unwanted symptoms. Reassess over time. Your best target number can change as you age. Reevaluate every 6-12 months to keep up with your body's needs. It's common to have questions. Here are some of the most frequent concerns older adults have about blood pressure, and what you should know. Should I insist my doctor let my pressure stay higher than 120/80? Bring the latest research with you. Ask about the safest range for your age, and don't hesitate to seek a second opinion if you're not comfortable with their recommendations. What if I'm already on several blood pressure medications, but my number stays above 140? Especially for those over 70, slightly higher numbers might still be safe, sometimes safer than adding more medicine and risking falls. Is it ever safe to adjust my medications on my own? Never change your dosage without consulting your doctor, but always speak up if you feel unwell or notice symptoms. What if my blood pressure isn't steady? Small variations from day to day are normal. Focus on the average values and how you feel overall. Remember, managing blood pressure in older age is more about the whole person than about hitting a single perfect number. Independence, energy, and preventing falls are priorities for a reason. The best number is the one that keeps you safe, functional, and feeling well. If you ever need extra reassurance or wonder if your current plan is right for you, ask your health provider about the newest guidelines and research. The information we once thought was best is always changing, and it's perfectly reasonable to expect your care to change along with it. Finally, if you found something in this video that could help you or someone you care about avoid a fall, improve confidence, or discuss your health more confidently with your doctor, please share this information. If you know someone on blood pressure medication who feels faint or tired, this could help them too. Safe, age-appropriate blood pressure management can make the difference between dependence and freedom in older years. Subscribe for ongoing advice and the latest health research explained simply, and let's keep learning together. Talk openly with your healthcare team. Advocate for yourself. Health is never one size fits all, especially as you age. Thank you for watching, and be well. See, striving for a blood pressure of 120/80 as we age may not be as harmless as previously thought. For those in their later years, working to achieve these numbers might actually lead to falls, fainting, and other serious consequences. We're going to unpack why the traditional advice may not apply so neatly to older adults, and why, for seniors, lower isn't always safer. Before we talk about the numbers you should be aiming for, I want you to really understand the why. Because only by understanding what happens in an aging body can you make the best decisions for your health or for someone you love. But first, if you're willing, share your current blood pressure numbers and your age in the comments below. This information helps others see what's normal, what's common, and how we're all different.